Maria Antonella Ruffino, Interventional Radiologist. I want to make a joke, but it's not my quote, that in this field, the only position for a woman years ago was as a patient. I'm a vascular interventional radiologist. I'm actually working in Lugano in Switzerland. Formerly, I was working in Italy, in Turin. I have about 20 years experience in this field. My main field is arterial, all the vessel, I have to say, from aorta to below the knee, also carotid. I wanted to be a surgeon. So I started attending in a department of surgery, and at the time I was focused on pancreatic disease, pancreatic cancer. So long procedure and of course a difficult patient, oncological patient. And some of these patients had biliary dilation, so they need a drainage. And so I was bringing them to the Department of Interventional Radiology, and I met the interventional radiologists who performed the biliary drainage. My thesis for my graduation was about biliary drainage in liver transplantation. So that's how I had access to interventional radiology. And during my post-graduation course, I had the opportunity to spend 1 year in the radiology department, where then I was hired in the years after. And I had the opportunity to work with one of the pioneers in Italy of vascular intervention radiologists, Dr. Claudio Rabbia, that was my chief later. And at the moment, it was very focused on the treatment of abdominal aortic aneurysm with another friend, a vascular surgeon working in Torino as well. So they started with stent-covered suit with graft. When I started actually in the Department of Vascular Interventional Radiology in Turin, there was already a woman, a colleague of mine, of course, for years. And we were actually the only two in a group of 5, 6 included the chief. I have to say that we didn't feel excluded from the others, but of course there are some limitations of yourself that don't get you related as a man to the rest of the team. Just not playing soccer on a Tuesday night is something that keep you out from some events. I always felt well accepted, so it was not an issue. But I know that in other centers, that was not easy. There was not access at all to interventional radiology, or at least was more difficult for women to be part of such thing. And there were not too many. I think that in Italy, at that time, it was the only interventional radiology with women working. When you think about to start a job that include radiation exposure, on-call, no time, because you don't know, you know when you start a procedure, but you never know when you finish. It gets your life very difficult to manage. It's difficult to manage if you have kids to pick up at school, in example. I don't have any family, it was my choice, and it's not because I was doing this profession that I took this decision. But there are people that for whom it's difficult to manage family and this kind of job. Radiation is also an issue because in our mind, pregnancy and radiation will always don't match that much. Even if a recent study, they say that the time to be and for not working, it can be reduced to really few months. But again, it's still one of the issues that a woman needs to face when compared to a man.
Have there been changes, general changes, that have helped to bring in more women to the field?
The system needed to do it, because if you look at who is attending to medical school today, most part they are women. At least in Italy, I can say that most of them they are Italy, so now the post-graduation course is plenty of women. And women have also interest to be an interventional radiology or a vascular surgeon. So many changes have already been done. In example, the pregnancy leave for a post-graduation course now well established in Italy. When I was doing the post-graduation course, it was not exactly like this. So I saw colleagues struggling to postpone pregnancy and things like that. So things are changed, but I think there's still a room for a lot to be improved. You sacrifice your life to a job, you need to have something back. The proportion of women involved in publication is still much lower than men, the proportion for men. So I was lucky to be included, involved. I've grown up with this generation of vascular surgeon and radiologists, so I had this opportunity. But we have to try first to make it more, to make it easier for women to have what I could have had. Of course, we need to have more information about radiation exposure. The new ESDS guidelines help a lot, but I think that we still need to really get access to this information to women that want to be interventional radiologists, vascular surgeon. And then we have tried to involve them in everything. Companies, in example, should support more women. Most of the investment they are still, in particular in the US, they are mainly on men. Not everybody wants to be a researcher, but it would be nice if more women could be involved also in investment in research from companies in anxiety. We still lack also of representation during meetings. The highest position in the societies, they are still represented by men. And so, again, we need to ask ourselves, is it because we don't want to do it, or because we don't have the opportunity to do it? Because it would be great to give everybody the opportunities, but also keep in mind, this is what I wanted to say is not just a man fault. Maybe that we are not too many who want to do this, because it's really time demanding, and if you don't have already enough time, it's something that is stealing from your life. I love my job. I have to say that I all my decisions that were made because I love my job in my life, and I have different satisfaction, let's say, from my job. When I deal with aortic procedure, complex aortic procedure, I like the technology. I like to approach this very complex procedure, but of course and this is nice. But it's also amazing when you have a patient with a rest pain, in example, that they are suffering a lot of pain for a foot ulcers, and they come to you and you perform your procedure. At the end, they don't feel pain anymore. This is also another satisfaction that is very important for me. So I won't say there's one procedure that gives me more satisfaction than another, and so I like it in every aspect. I have to say that gender doesn't influence the way you should treat a patient, in my opinion. If I have to say something that really makes the difference is your approach, no matter if you are a man or a woman, to this profession. So I don't believe that we are that different. We can be a good doctor or bad doctor, but not because we are a man or a woman. Someone wants to be an interventional radiologist, no matter the gender is. So don't be shy. Don't be shy to try. Don't be shy to ask support, ask to be part of something. Don't be shy to make a question during a meeting. Don't be shy to get close to opinion leader. Because everybody we are just very busy, but we are open, as my man colleague, we're very open to be approached to anybody who wants to learn more about our discipline and our job.